Welcome everyone to the September 13th, 2021 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwizdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn, present.
Bill Muller.
Bill Muller, here.
Jennifer Maynard.
Ben Maynard, present.
And Austin, I know, had said that he had a conflict, so he won't be here. Then staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Let's see, Nancy is off today, so I know she won't be here. Danielle Edmonds.
Here.
And then Colleen Bolin from the Alliance also.
Here.
All right, thank you both for joining us. I would like to open the meeting. Can I get a motion from one of the members to open the meeting?
Yep, this is Dan Finn. I make a motion to open this meeting.
All right, is there a second?
This is Bill Muller is the second.
All right, and then all in favor, and as a reminder, do it individually and then state your name when you're doing it also.
Dan Finn, aye.
Bill Muller, aye.
Ben Maynard, aye.
Karen Gwizdowski-Govin, aye. All right, the meeting is opened. Good evening again, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until April 1st of 2022 of the remote meeting provisions of the March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. And there are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website identifying how the public might join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything you broadcast could be captured by the recording. Any supporting materials that are provided to the members of this body are available on the website of the town unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first topic on the agenda, I just want to cover a few basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. As always, I'll introduce any speakers on the agenda by topic. If there are any questions or comments by any of the board members, please ensure you go and ask to be recognized through me, the chair, so that way we're following appropriate protocol. Please remember to mute your phone or your computer, whichever you're using, when you're not speaking. And then, of course, please remember to speak clearly and in a way that helps generate accurate minutes. Let's see. I think that is it. Any votes, if there are any taken during this meeting, will be conducted by roll call vote. All right, so first topic on the agenda is the Alliance update. So Danielle or Colleen, who's gonna kick that off?
Danielle, if you want to start with just the environmental health piece, and then I can take it over with some of the other office and general public health updates.
Sure, be happy to. So I emailed Karen a list of the inspections done since the last meeting. You can see that there. The businesses have been doing really well in regards to, abiding by the food code. Unfortunately, they do say that, help is few and far between, but, they are doing great besides that. And then I worked the Pet Rock Festival this past weekend. That went pretty smoothly. The only thing that I had to talk to the coordinator about was just getting their information in a more timely manner. That was the only thing that I had to speak with them about. Other than that, no complaints.
Mhm. And I had forwarded the, I'm sure the members loved it. I think it was Sunday. I was just a barrage of emails of things to look at. Danielle, the report you had forwarded was one of them. Any questions from the board members? Dan?
See, there we go. Yeah, Danielle, I just have one question regarding the residential kitchens. I'm assuming that you give them a little bit of a heads up that you're coming, or as opposed to just dropping it by and inspecting their kitchen, or do you?
Oh, absolutely. So that is really the only food establishment that we do give a heads up to, just because it is in their home.
Right.
Everyone else we just do drop-ins. So yes.
Yeah, I don't think you'd want to come into our kitchen with a white glove without letting us know. But anyway, thank you.
Any other questions, board members? On that? Not seeing anything. All right.
Karen, are you good for me to continue on with some of the updates? Okay. All right. So for those that don't know me, I see a couple new faces. It's been a while since I've joined one of the Grafton Board of Health meetings. My name is Colleen Bolin. I'm the Deputy Director for the city and the Alliance. Prior to COVID, I used to be a regular every month when we were still meeting in person, but it's become a little more difficult to be able to hit all the meetings during COVID. So it's nice to be back after quite a while. Some general updates that I have for you, most of them are on the monthly update, but then I have a couple additional things besides that. So just scrolling through the monthly update quickly, certainly in terms of COVID, as is probably no surprise to anybody, cases are certainly increasing. I've printed out just for my own reference, and you should have all received today case counts over the past several days through the city, Worcester, and Worcester, Shrewsbury, and Grafton. So certainly Grafton, you're still getting cases. Kind of fluctuates between maybe just a couple some days and then a handful or more some other days. But certainly overall, the trend in all the Alliance communities has been that we have seen that uptick in cases. So certainly we've been working with the nurses to make sure that all the cases are investigated either through our City of Worcester nurses or through the state's contact tracing collaborative, which has been in place since early on in the pandemic. That state contact tracing collaborative will be ending. So that's something that originally it was going to end in, I believe, September. They have pushed it till, I believe, November or so. But certainly as of right now, we do not foresee having state support into the new year. The state did put out funding that municipalities could apply for. We did apply and receive funding to bring on a to continue working on contact tracing, support just Worcester and our Alliance communities. So we will be working to bring on a couple contractors that will help with that additional support, especially if cases continue to increase or stay at the amount they're at now. We'll have folks to help us with that case investigation and contact tracing. So we'll bringing on probably over the next month or two, we'll be bringing on additional support as the state support winds down. In addition to that, we did receive another pot of funding that we've talked about in other updates. We didn't have it in this update, but I just want to give you just a quick summary of where we're at now. We received funding from Mass DPH. It's called Public Excellence Funding, to be able to, in our case, really take a deeper dive and look at how our model works. So, we've been doing this model for 10, 12 years now, right? Starting with Shrewsbury and then bringing on the other communities. The state is really looking to bring on these regional collaboratives all throughout the state. The state's goal is that there will be no community that stands alone. They want all communities to be part of a regional collaboration. So the funding that was awarded, this public health excellence funding, the main use of the funding that people could apply for was to actually join collaboratives, right? Form collaboratives, or to increase your membership into a collaborative that you already have in place. We had asked the state for a third option, which would be to use the funding to really examine what the past 10, 12 years have been like. And they agreed. So we will be bringing on a consultant to really spend a couple months doing a cost analysis, doing a lot of focus groups, key informant interviews. I imagine that this consultant will be talking to all of you as Board of Health members. They'll be talking to the town managers and administrators, staff, to really understand what our current model is, what's working well, what are some challenges, what are some opportunities for improvement, and then writing up a business plan proposal of moving forward and what we can do to really enhance the model that we have. That is why we only did 1 year IMAs, right? So for FY22, the IMA is only for that fiscal year, to really give us the year to be able to work with this consultant, look at what we have, how we're operating, and then look at, maybe we don't need to change anything, but I like to think there's always room for improvement, right, and growth. So how can we incorporate a lot of that into future IMAs starting in FY23? So we're almost at the point, we're finishing up the scope of work with the law department. So hopefully the scope of work for a consultant will be posted on the city website within the next week or so. Then they have a couple weeks, through proper procurement practice, a couple weeks that'll be posted. We'll review proposals, and then, we hope within the next 6 weeks or so to have secured a consultant that will be on board. And then we'll have much more engagement with not only city staff, but also all of you as members, town managers, administrators as well. So definitely a lot more to come this fall, because our hope is really that, the information that comes out specifically regarding the cost analysis, we want to make sure that the towns have that information prior to budget season, right? Before we know it, it's going to be budget season working on the FY23 budget. So we want to make sure that we have this consultant secured for the fall to take a couple months and do this, and really have that proposal and that roadmap for moving forward in FY23. So a lot more to come on that as well. Any questions on those pieces before I keep going? Okay, a couple other quick things. You may have read in the monthly report about the isolation and recovery hotels. So this was during the height of COVID back in 2020, that spring. There were hotels all throughout the state. So individuals that did not have a place to safely isolate if they were COVID positive could go to one of these hotels that were run by Mass DPH. Right now, there's one in Boston. So we have had some instances where in the city, there have been folks that needed to utilize it. You call this number that's posted, and it's also listed within the monthly update, and there's transportation to bring that individual to the Boston site. As cases increase, the demand may increase at this Boston site. And certainly if you're in Central Mass or Western Mass, it's quite a distance to get there. So there is talk of opening another site somewhere in the state, maybe more Central Western Mass, but nothing definitive that we've heard about yet. But just to be aware, if that was something that was to arise in your town where you did receive a call or you heard of somebody that did not have a place to safely isolate after being COVID positive, there is that option. And we can certainly help facilitate that call to Mass DPH, or certainly anyone can call that number, right? Any one of you could also call that number. We also welcomed, excuse me, you saw in the update, we welcomed a new team member to our community health team. Idalia started last month. She's working in our community health office on our REACH grant, which is a large federal grant that we have. The grant is Worcester specific, so she's mostly her service area, so to speak, is really just the city. But we always tried, if there's different initiatives or educational information that comes out of this grant for the city, what, if anything, we can dovetail and adapt for the towns as well. So there could be some things coming out about that. The grant is really to focus on public health in the Latino community. So it's very specific to the Latino community, but certainly as information and resources come out, if it's appropriate, we can certainly share with the town as well. So we're happy to have her on board. And we also just hired, and she started this week, our new regional public health nurse. So we are very excited. As you know, Amelia Houghton used to be the regional public health nurse, and her and Pat would be providing public health services in Grafton. Amelia actually moved up to our deputy chief public health nurse during COVID. So she's still supporting Grafton, but we were very excited to get a fourth public health nurse on board. And she just started on last Monday or last Tuesday, I guess, right after Labor Day. So I anticipate, within the next couple weeks, Amelia will bring her in to town to meet folks, or the next blood pressure clinic that's going on, but we'll also make sure to get her on a upcoming Board of Health agenda, just so that you can meet her face to face, so to speak, but you can put the face to the name. But we're very excited to have her on board, and Amelia will be training her up to help support nursing work in the town of Grafton. All right, and lastly, I will say, and then if you have any questions for me, our tobacco control inspector, her name is Cherry. She would like to come, if possible, to the next Board of Health meeting or the one after, however it fits within your agenda, just to talk about tobacco inspections in the town of Grafton, give you an update on how inspections are going, information about any retailers, and also talk to you about any regulations. I don't remember the last time any of your tobacco regulations were updated, revised, or passed, but she can walk through all of that with you if there's anything that you're looking to talk about in more detail, or tell you options of suggestions that the state has put out for any updates to your local regulations. So she's more than happy to come to the next meeting, or like I said, the meeting after, however it works on your agenda.
All right. Yeah, we'd love to have her.
And that is all I have, unless anyone has any questions for me.
Dan?
This is Dan Finn calling. Just a quick question. What local towns are sort of on their own, maybe Sutton, Upton, or in terms of service that are
Well,
not part of a collaborative?
That's a good question. I
Westboro?
believe towns around us would include, I think, Sutton, but I'm not totally positive. I believe Rutland, but again, I'm not completely positive. The state has a map that I will try to find, because I think they've sent it to us at one point, that basically shows every state and then who's tied to a collaborative.
Yeah.
And there are certainly some spots that definitely are out there on their own. I'll try to find the map. I know there are some communities near us or near us that currently are not part of a collaborative, though.
Yeah, I'm just curious. I'm sure you'll be digging into that pretty soon with this new new thing that you're going to be looking into, but I'm just curious.
Yeah, I'll try to find the map.
Thanks.
Any other questions for Colleen or Danielle? And then I know back when Jennifer is our newest member, and then Bill is our next newest member, but I know at least Jennifer, because you're more recent, forgot how many meetings you now have been with us, 2, 3, this might be your third. It's been a blur lately, a whirlwind, shall we say, thanks to the COVID uptick especially. Were you ever able to connect, Jennifer, with anyone with the Alliance to kind of learn more about like what they do? Because I mean, they definitely could say better than me or even or Nancy or Dan, like what they do.
Yeah, I sent a note over after our July meeting because that was my first one where I had all sorts of questions. I haven't heard back on a timeline for when somebody could either have me around for a meeting or do a Zoom to kind of go through the different offerings with the Alliance and, different things that we could be helpful for on the Alliance. I think, for me, certainly it would be helpful to kind of hear about, especially with this upcoming study going on too, like what's changed for Grafton from prior to having the Alliance. But I have not been able to connect with anybody. I'd be very flexible to, work around schedules. I think I sent a note over to Julie. It was a while back. So I would love to do that because as I said, I'd like to know a little bit more about what it is we get as a town and maybe what our needs might be beyond what we get.
Absolutely. Jennifer, I can work with you to schedule something. And maybe we can even bring in, so I know Karen Clark, our director, would probably love to be a part of the conversation as well. And then I can see if some of the other chiefs, so we have Chief of Community Health, Environmental Health, which is Julie, and then we have a Chief of Emergency Preparedness and Nursing. So I can include them in there as well, so that everyone, you'd be able to meet everybody, but you could get a little bit of information about each office. So I can certainly set that up.
Awesome. Thank you. I can, if I have your email on one of our emails, I'll send you directly so you have my contact info.
Perfect. That sounds great.
Thanks.
Thank you. Yeah, I wasn't sure, like I said, everything's
No, thank you. I just was about to send you a note about that, Karen. So
goes fast.
perfect timing. you might have an email in there already.
And you know what I can also do, I can include, if you want, all the Board of Health members. And then if others want a refresher or it's been a while, anyone's welcome to join. So I can include all of you if you want, and then whoever can join is more than welcome to.
Yeah, because there could be areas that we haven't, as a board, had to really, we'll call it, worry about, focus on, because obviously, as everyone, thinks about it, like the biggest focus has been COVID for so long, and it's not that we forget about other parts of what's going on, but they're not what I would call top of mind compared to COVID.
Absolutely. And actually, that reminds me of just another update, the Regional Youth Health Survey. So that was something that got sidetracked due to COVID that will be happening this year. Karen has reached out to superintendents in all of the communities. I know our team is having a internal planning meeting next week to talk about logistics. And most of the communities, it's done online now anyways. It's not the old paper surveys where we had to deliver reams of paper and pencils to every community school. So luckily it's electronic now for the most part in the communities. But we're gonna work with our team internally to talk about some of the logistics, and then we'll be back in touch with communities on the actual rollout. So certainly something to keep in mind that this will be happening. And I also made a note, maybe the October meeting, to see if somebody from the community health team, if not October or November, could be part of the Board of Health meeting just to give an update on where we're at with that. But that will be happening at some point, I believe, this fall. Superintendents wanted a little bit of time to start school, see how things went, right? And kind of get into the groove of the school year before we sprung this on them. So that will be coming out at some point. So we'll keep you posted on that.
We had heard, I can't remember if it was last month or the month before that, about a grant on the tobacco cessation for the high schoolers. So I don't know, maybe when we do the tobacco update, we can maybe get an update on any traction that's been done in the schools with that, now that they're back.
Sure.
Yeah, Colin, I think it was tobacco, there was drugs as part of it, vaping, it was the grant. I forgot what.
Oh, is it Mass Call 3?
Yeah, Mass Call 3. I was like, I can go back into my notes, but by the time I open it.
Yep, absolutely.
Any other questions for Colleen or Danielle on the Alliance update? All right, seeing none, we'll jump into our typical topic for the past year and a half-ish now. COVID updates. First, data and variants. I'll go through kind of our usual case counts, et cetera. As of September 13th, Grafton's been informed of a total of 1,300 cases even as of today. Confirmed positive COVID-19 cases since the tracking started back in early 2020. As Colleen mentioned, the cases are definitely still on the upswing in Grafton, surrounding communities, the state, the country, globe. Right now, Worcester County and the surrounding areas are still considered to be high risk per the CDC's classification methods. Individuals, and I say this every time in meetings, individuals are strongly advised to continue to exercise precautions, even though the state has removed pretty much all the precautions and restrictions such as mask wearing, social distancing, frequent hand washing, not large gatherings, etc. Because the Delta variant is still circulating, and now we have the MU variant that's starting to show up more, but they're still looking into that one to see how much of a concern it truly could be. But it doesn't seem like Delta's going anywhere anytime soon. So definitely at this point, continue to do those precautions that we all got used to over the past year and a half now. Given the elevated risk level that we're all still at, the CDC continues to advise that all individuals do wear face masks when they're indoors in public places, regardless of your vaccination status. And then Massachusetts had released a mask advisory maybe a couple months ago now, that fully vaccinated individuals are advised to wear face masks when indoors and not in their own home if they have a weakened immune system, or at an increased risk because of age or an underlying medical condition, or if someone in your household falls into one of those criteria. In terms of vaccination efforts, we're still at the point where there are the 3 vaccines that are out there, the Pfizer, the Moderna, the J&J. The Pfizer has the emergency use authorization for 12 plus. Pfizer has also been approved by the FDA for 18 plus. They did not do the actual full FDA approval yet for the 12 plus population. I've heard, but until it actually happens, it's not there yet, that Pfizer will be, I think, applying for a younger age population. I think the last article I saw might be like sometime in October, maybe, that they might try to put in that approval. But more to come on that, obviously, because we're nowhere near October at this point, especially late October. As a board, we continue to strongly recommend that all individuals who are eligible get vaccinated, because that is one of the best ways to prevent getting especially severe cases in hospitalization or unfortunately death. As we've all seen, it doesn't mean that you're necessarily not going to potentially get COVID, but they are showing that the likelihood of you getting into the hospital or having severe illness or potentially dying from it is definitely reduced if you're fully vaccinated. In terms of third doses, at this point in time, the only authorized third dose, or well, there is no authorized second dose at this point from a J&J perspective. So the only authorization out there so far is for third doses of Pfizer or Moderna for certain immunocompromised individuals. And the FDA and CDC listed out what they mean by moderate to severely immunocompromised individuals. And those third doses should be at least 28 days after an individual's second dose. And they strongly recommend it's the same vaccine for the third dose as your first and second dose were. As I mentioned, as of right now, there is no authorization for a booster as such or an additional dose for J&J vaccine. So more to come on that as the government looks through data that gets provided. Any questions on the case counts, the variants, recommendations, vaccinations, et cetera at this point? Before we jump to any mitigation efforts. Did I miss anything, Colleen or Danielle?
Karen, the only thing that I would add is the state had sent out a survey to local boards of health maybe 2 or 3 weeks ago, asking for local health's capacity to be able to support doing third dose or booster doses. And we did reply on behalf of the city and the Alliance communities that we would be interested in supporting that effort. We don't know completely how that will look yet. This was more exploratory on the state side, I think, to see who locally had interest and the capacity to be able to do that. So definitely more to come. We don't know any more at this point, but we did respond to that survey to say that that is something that we would be interested in continuing on with that vaccination kind of leg of this pandemic journey that we're on, but we don't have any more details at this point.
Thank you, and thank you obviously for responding to that. All right, so if there's nothing on that, then in terms of mitigation efforts, the Alliance had forwarded, and then I forwarded off to the rest of the Board of Health members prior to the meeting, a couple executive orders or executive emergency regulations that were issued in the city of Worcester by Dr. Hirsch, the medical director there, that it sounds like the Worcester Board of Health plans to ratify in an upcoming meeting. Just at a high level, the two were: one, mandatory reporting of positive COVID cases by businesses. That mandate at a state level had been rescinded by the governor, which means currently there's no mandate out there for the vast majority of communities unless they're putting in one of these emergency regulations that says a business has to do certain things, including reporting of positive cases so there can be contact tracing, et cetera, and proper cleaning, of course. And then the second one was mandatory masking for all students and employees in all public, parochial, charter, and private schools in Worcester. So I wanted to forward these off to the other board members for review in advance so we could have a discussion in terms of, is there interest at the board level of going down the path of pursuing either of these, or both, obviously, from a Grafton specific focus? And then if so, my tenure on the Board of Health, I don't think we've ever put in an emergency type regulation. So we want to make sure that if we go down the path of exploring this further, we want to make sure that we have our ducks in a row, obviously, and are doing it appropriately. Dan, you're off mute, so I'm assuming you want to talk.
Yeah, I guess. And I think it was it 100 employees, businesses with 100 employees or more in that particular? Was it all businesses? Do you recall?
I thought it was all business. The 100 employees might be the vaccination at the federal level.
Okay, right, okay. But anyway, yeah, I think it might be a little premature for us to ratify either of those two. I mean, I think we should probably check with any private schools, like thinking of Touchstone, and I don't know if there are any others, to see if they have a protocol in place. But legally, I'm not sure. It might be a precedent for us to put those measures into place yet, but perhaps maybe review it again in October is what I would suggest, the October meeting.
Thoughts from the other members?
Yeah, Karen, this is Bill Muller. I mean, I think we've already kind of supported the superintendent's mandate for mask use in the public school system. As Dan has alluded to, I think the primary private school would probably be Touchstone. I know my youngest granddaughter is now going to preschool, and she has to wear a mask every day. So I think a lot of the schools have taken this upon themselves anyway. I mean, certainly younger children can't be vaccinated at this point. So that's a primary sort of concern for that population. I think there are two questions. One is, do we have the authority to do it? Because I think Dr. Hirsch actually alludes to some bylaws in the town of Worcester, or the city of Worcester, that really authorizes him to take that action. But I don't think it would affect too many of the schools, except perhaps for Touchstone. I would think the Touchstone probably is doing something in terms of masking as well.
Dan?
Karen, this is Dan again. Yeah, and on the second piece, on the first actually, I don't, due to our sort of temporary reduced capacity in the office, it would be very difficult to keep track of the business piece. I don't even know if we have a list of all the businesses in town. I guess we do have a list of the ones that that have food service and that. But again, I think we should hold off personally, is my opinion on that one also.
Yeah, I think I think I agree about, I don't really understand or know what our ability is from a legal perspective on the private schools with the masking. I think for also the reporting requirements, our numbers don't really tell us whether or not the people that are reported also work in businesses in Grafton, because some of those places are probably required to report to their Board of Health if they work there. I guess it's certainly in the best interest of any employer to contact trace within their own company, even if they don't have to report it to a Board of Health. But agree with Dan that I don't know about our capacity to be able to take that on at this moment. Or some of the businesses where I think they did cite, some of the businesses are struggling as it is with staffing. But I guess I would say that, we as a board would certainly encourage, or I would think that we might encourage businesses to just be mindful if they have staff popping up positive, to kind of know where their movements have been, if they've had contact with other employees, because that'll further be a challenge for them in whatever their service industry is, I would say.
Colleen or Danielle have any of the other, I know this came out not that long ago, so I don't even know if any of the other boards have even met yet or not. Have these?
Yeah, this has been a topic of conversation at several of the different boards. I know West Boylston has moved forward with some Board of Health regulations regarding masking. I think just overall in the community, when inside a business, I believe. The other boards, I believe, all have, masking if you're in a municipal building, which I believe you guys have as well.
Yes.
It's certainly a topic of conversation throughout all of the Alliance communities. I would say to Dan's point, the employer reporting piece, you definitely have to have some capacity and a structure in place, because our calls flooded in the city, and certainly we have more establishments in the city than you would have in Grafton, but certainly our experiences, people are complying with that. And so, what's the internal process? We have a process in the city of when the calls come in, logging the calls, working with inspectional services in the city, because we're actually split. We don't provide, Julian, Danielle, and Micah don't provide environmental health inspections in the city. They only do it in the Alliance. So we're working with a different department in the city in terms of trends or some clusters. Certainly during the spring of 2020 and that summer, we had some fairly large outbreaks within different business settings, right? Which I think made this a little more on our radar, that this was something that we kept a close eye on previously during previous surges. But certainly there is a capacity need to be able to, if all these calls come in, right, who's tracking them, who's looking for those trends. But, you know, like I said, definitely something that we're hearing, not just within our alliance, but statewide. These conversations are happening, and it's a mix in terms of those that are waiting and seeing how the numbers continue to look, right, and those that are taking action right away.
Any further questions, comments, input? Dan, Jennifer, Bill? Can always revisit if we want to. Oh, Dan.
Yeah, that's what I was gonna say. If we can just table it until our next meeting, unless there's some incredible resurgence, and then we may have to meet in between, but I'd say we hold off.
I think we have less than a month in between meetings just because of we couldn't do it on Columbus Day, Indigenous Peoples Day. So we chose to do it before, not afterwards. So we wouldn't be too far spaced apart. So.
And the last thing I would also comment on is to include your legal counsel early on. In the city, our legal department was incredibly involved from the very beginning of having those conversations in terms of the legality piece, how it should be written, what. And so I would definitely also suggest, if it was something that at some point you were going to pursue, to make sure you have town administrator, but legal counsel in particular, a part of the conversations early on.
Yeah, that was my thinking. I'm like, we in this town don't have, from a board of, like I said, I've been on the board of health now 14 some odd years, something crazy number like that. And I'm like, I don't remember us ever having anything where it was like, we're going to put in something above and beyond the state in an emergency type situation, not a, hey, we're going to update our tobacco regs in advance of what the state's doing in a normal, slow kind of cadence. All right. Well, that's all I had for COVID, at least as of right now. If there's no further questions on COVID, we jump down to Tripoli, West Nile, and ticks. All right, so as a reminder to everyone, tick season, mosquito season still here. In fact, Grafton was notified a couple weeks ago now of a mosquito that was positive in Grafton for West Nile virus. We notified the community. There was, now since we do have the benefit of being part of the Central Mass Mosquito Control Project this time, unlike when we had the Triple E problem a couple of years ago, they were right on top of, here's the defined area, here's when we propose in spraying, here's, you know, the map to notify people, and then, you know, a time was finalized and date was finalized for the mosquito spraying. I haven't heard of anything since then, knock on wood, from anything positive for another mosquito or anything, so that is definitely positive. Reminder for anyone who may be watching this that for mosquitoes, please remember the 5 Ds, because we are not out of the season yet, about dressing in long sleeves and pants when possible, especially during the periods of mosquito activity. DEET is an effective repellent, as Dan mentioned at the very beginning, since he's sitting outside. Dawn and dusk are mosquitoes' most active periods. Drain any water from containers you might have on your property regularly. And then we have a variety of helpful tips and info on the Board of Health website. And then for ticks, we're also not out of that season yet. Use DEET or another effective repellent. Do a tick check on each person in your family who has been outside, especially those hard to see areas like your hairline, scalp, armpits, etc. And then if you do have any pets that have gone outside, do check them also after they've been outside, because ticks can be pretty good at burrowing down through some fur where you might not see them. They may not be right on the outside area. Any questions or comments on Tripoli, West Nile, or ticks? All right. Seeing none. All right, final topic for the agenda is flu clinics and EDS. I did check in with Nancy. She wasn't 100% sure off the top of her head as to whether there was a pre-booking of any doses or not for the year for any type of flu clinics. So,
And Karen, I meant to ask Pat on Friday before she left on vacation today, but I know she talked last week regarding flu for the fall, and she had to check to see what she thought had been ordered, but she was checking to see if anything had been ordered and what that was. So I will follow up. She's back in the office tomorrow. I'll follow up with her regarding that, and then I can get back to you with an update.
all right. So coming out of that, if something was ordered, then similar to previous years, we would need to obviously plan something, communicate far enough in advance, etc. I mean, some of what happened last year around how to do it from a restriction perspective, because at the time we did have, state level restrictions on how many people you could have in a building, etc. So, I mean, normally we typically do it in the senior center. Dan, you're even closer to this than I am, so obviously correct me if I'm misspeaking on any of these, since typically I can't make them based on the time that they happen. I know last year we went through all sorts of thought processes in terms of, did we try to do a drive-through? Do we use the gym?
Right. Yeah, and typically it's has been mid-October to late October. I think last year got pushed out a little further, also because of the availability. It wasn't coming in.
Yeah, that too.
So again, I think at our next meeting we're going to have a little more concrete information as to if it's coming and when we can schedule something and where. Yeah.
All right, that's all I had for the topics on our agenda. There was no old or new, there's no correspondence that I know of. Upcoming meetings, October 4th, November 8th, December 6th, December 27th. So there's nothing else that I am seeing.
Karen, I thought you had sent us some documents about cuffs. Were we going over that today or no?
It wasn't something on the agenda to go over. If there are any questions, feel free to shoot them my way.
Okay.
Yeah, and excuse me, this is Dan again. I believe Julie's been keeping up with that too, so it might be good to shoot a question off to her if you have any.
All right, so that was it on the agenda.
Oh, this is Dan. I'd like to make a motion to adjourn this meeting.
This is Bill Muller. I second that motion.
All right, roll call vote.
Yep, Dan Finn, aye.
Bill Muller, aye.
Or die.
Karen Wozlowski-Govin, aye.